Imagine you are waiting in a long line to purchase coffee. Everyone in front of you is speaking a different language, and the barista is scrambling to search for translations for each order. Everyone is simply trying to order the same thing: coffee. The line is moving extremely slow and inefficiently due to the communication barrier. Have you ever considered the similar language barrier within healthcare? This is a familiar problem in the healthcare industry. Just as understanding the nuances of a different language from your own may be challenging, learning how to navigate the healthcare system can be just as difficult without the appropriate resources. Here, we will dive into a study regarding access to healthcare policy information within physical therapy. However, this applies to all those involved in the healthcare system, including providers, payers, and patients, as similar limited access to information exists across the board. When treatment is provided within the healthcare system, the medical provider is responsible for understanding the payer's medical policy to secure the reimbursement of their services. The payer, often an insurance company, can approve or deny billing claims based on their policies. But the problem is that these policies vary from insurance plan to insurance plan. We're talking thousands of differences here, people. To make matters worse, these policies are often hard to find or simply unavailable for the public to access. Can you see the problem? This lack of transparency can cause a wealth of confusion for everyone involved, including healthcare providers and their patients. When it comes to health insurance and policy paperwork, people can easily feel buried, no matter if you are a patient, provider, or payer. So if that's you, you're not alone. You know this all too well if you've ever tried to understand one of your own medical bills. Health insurance companies and medical providers communicate claims information using a standardized electronic form, with about 95% of claims being submitted using this one form. The problem, however, as highlighted by the American Medical Association, is that the government permits more than 1,200 different ways to fill out that same form. Imagine the time it would take for providers to find the proper information for each patient in a day. I know what you're thinking, and you're right. It's as crazy as it sounds. We think you get the picture. Medical policy and healthcare forms are rough. And so, the Marquette Project was born. Doctor of Physical Therapy students from Marquette University examined 5 national insurance company websites to find key payment policies and rate them on ease of access. These plans were Aetna, Cigna, Humana, TRICARE, and United Healthcare. Additionally, these students reviewed and documented the top 3 insurance companies in all 50 states and gathered their results. The students were tasked with locating payment information for these top insurance companies online. A scorecard outlining a total of 30 items was used to search through 6 main topics, which were: locate the payer's website, locate the provider policy manual, locate the physical therapy policies, locate utilization management policies, and locate supervision and delegation policies. During the first part of this project in 2015, the students ranked the items from 1 to 5 based on ease of access. Part 2 in 2016, when information was not accessible online, as it often was, surprising, I know, the item was assigned a number 10, indicating it couldn't be found after a maximum search time of 30 minutes. More importantly, students started to record the amount of time it took to locate each item. In Part 3, the students were not limited by the amount of time spent on each section. After 3 years worth of data, the Marquette Project found that the gold standard for policy transparency was Medicare. What? That's right, you heard me, Medicare. Not only was policy information for other insurers difficult to find, but in some cases it was downright impossible to track down. Medicare was standardized, easy to find, and clear. Over the years of the Marquette Project, 26 insurance websites changed their addresses and 13 were password protected. This alone creates a huge barrier for the public. Overall, the average score for all insurance providers was a 6.84 out of 10, meaning that the average time it took for students to locate, not even read, items on the scorecard was 42 minutes. Since a 1 rating meant the policy was easy to find and a 10 meant it could not be found, the insurance company's payment transparency scored a solid F. That's one report card no one wants to bring home. This begs the question, where do we go from here? A good place to start is by simply realizing that providers, payers, and patients would financially benefit across the board from filling out the standardized payment forms in the same way. The ultimate goal is simplification. As the Council for Affordable Quality Healthcare reports, if these standard transaction forms were filled out consistently, 11.2 billion would be saved annually. In case you're wondering, that's over 3.7 billion cups of coffee. So if doctor of physical therapy students had a tough time finding information, imagine how hard it would be if you don't have a computer. Or imagine that English is your second language. Or that you're a small business just starting out. It's time to rethink this. So how can you join the movement? Start by educating yourself, whether as a provider, a patient, or a payer. Look for lack of transparency. Contact your insurance company and reach out to your legislatures for change. Standardization is achievable, but we need your help. Feeling motivated? Here's some information about how to get involved. Contact Jim Hall, co-founder of the Marquette Project, by email or phone to find out how you can be the change.